I'm about to go inside. They told me to be here at 7:30, so I'm here. I'm ready to get cut on. Let's do it. Hi guys, Hello Bella here, and today I am oversharing to the max. I am going to be talking to you about having my breast augmentation. I had a breast implant exchange with a lift, so I had the full spectrum of surgery that you can have on your breasts, and I am so happy with the results. I'm 10 days post-op. I'm feeling a lot better. I'm still trying to rest, still trying to take it easy, and I'm going to be talking about everything about booking the surgery, how much it costs, the steps that I had to take to get this done, and overall the first couple days of post-op after my surgery. So what initially led me to have another surgery, I got my first implants when I was 18, and I had some pain in my breast area. It was sort of unexplained, so I went to my OBGYN and she sent me for an MRI, and they told me that I had capsular contracture, which actually wound up being wrong, which I'm so glad that I went ahead and had the surgery, because when my surgeon went in to remove my old implants, he told me that one of them had completely ruptured and it had been leaking out basically silicone, and it had also been an implant that is no longer even used because it's not considered safe. It was the textured implants, and he said it works like Velcro to basically stick onto your body, and he said that they're no longer considered safe because they're linked to some lymphoma cases. So I actually wound up getting those removed, and I'm so glad that I did that. I am very kind of disappointed that the MRI results that I had did not tell me any of that. So the reason that I had said, okay, let me just go ahead and get them redone, is because I thought, well, I need to get these out anyways if I'm having the capsular contracture thing. And I thought, you know, these have been in for about 12 years, so it's really time for them to come out anyways. And I was ready to have a lift. I won't say that my boobs looked bad by any means. Like, I felt like they were fine, but now they're definitely fuller. They definitely have some like upper fullness. I never had cleavage before. Like, I felt like my cleavage was all on the bottom, and now I feel like I have it on the top as well. Like, I have more of a form whenever I wear like a v-neck or something. It's definitely a lot more obvious that I have some cleavage. So I did go from 400 cc's to 550 cc's, and the reason for that being is that I wanted them to have more upper fullness, and so most of the breast that I had before was kind of leaning towards the bottom. So with the lift, they bring it up higher, and then he also added the implant that would be more of a high profile type of implant. So I mean, I'm really happy with it. It's hard to know right now exactly what it's going to look like because it's only been 10 days, but people have told me, like, after the first week, you know, it doesn't really look great, and then after 6 weeks it starts to look better. After 6 months you'll be really happy with them. So that's kind of the rule of thumb when it comes to breast implants, and right now I feel good about it. I don't feel any regret. I definitely woke up in pain after surgery, but I'll talk to you a little bit about that further on in the video. In terms of choosing a surgeon, I went with one that was in Birmingham, Alabama. That's about 2.5 hours from me. The office was Head and Gun Plastic Surgery, and my surgery wound up costing $7,700. So this was for the full implant exchange with a lift, and they did remove some of my breast tissue to, I guess, you know, make room for the other implant that was going in, and also to kind of do the lift. So I'm not sure exactly how that works, but I just know that I went in looking one way and I came out looking another way, which is really, I guess, the ultimate goal. But in choosing my surgeon, I met with them the day before the surgery. That was the first time that we met. I opted for an online consultation because I didn't really feel like the need to drive 2.5 hours. I sent in photos of my breasts, and he basically told me that he thought I'd be a good candidate for a lift and an exchange. And so I did wind up meeting my surgeon the day before the surgery. So I know that not everyone would be comfortable with that, but to be honest, they kind of all run like an assembly line anyways. So I met him the day before surgery. We talked about sizes. I told him that I wanted to stay honestly around the same size that I was, but I wanted that upper fullness that I didn't have before. I told him I was okay with going like 10 to 15% bigger, and he said that since I felt like I could go bigger, he said he would put you know, some that was more on the top, because the main issue I had was that I got my implants when I was 18, and I'm 29 now, so just time and gravity. I mean, it's pretty self-explanatory. I had not had any children, and One thing I'm kind of worried about is if I do decide to have children, I have no idea how that's going to go with these implants. I'll probably have to have another surgery after that, but I'm not too worried about it. I mean, I am slightly undecided about kids right now, but it's something that I feel like I wanted to do now. I don't want to wait on, anything, especially after I learned that that implant had ruptured. I was really glad that I had made the decision. Like, something told me that something just needed to happen, and I kind of went with my gut, and I'm really glad that I followed it. So the day of my surgery, I was supposed to show up at 7:30. They took me back, and I think I started everything, got the IV in about 8:30. They took before pictures. They asked me a bunch of questions. I had to do a pregnancy test, and I'm sure that, everything had to be set up for my surgery. But everything went relatively smoothly that day. My mom stayed with me. We did book a hotel room in Birmingham, and we stayed there for 2 nights. So we came up the night before surgery. We did the pre-op appointment, and then the next day I had my surgery, and then we spent the night there. And then the next day I had a post-op appointment, and then we went home the day of the post-op appointment. So altogether, I had 3 days in the area that I had my surgery. From the time I woke up from surgery, I immediately felt pain pretty bad, and I had a horrible headache. Well, it turns out that the stuff that they put on your nipples to try to get them to basically get blood flow going is something that causes a major headache. It's a cream that you have to rub on them every 6 hours after surgery. I'm sure this is relevant mostly for people who've gotten a lift, but the cream causes headaches. So as soon as I got in the car, I basically came to from the anesthesia, and the nurse was getting my clothes to put on me. So they did not take a lot of time to let me wake up and come to. She was basically getting me dressed. I remember waking up and feeling pain and thinking oh my God, what have I done? So she wheeled me out in a wheelchair to my mom's car, and I got in the car, and I looked at the nurse, and I looked at my mom, and I said, when can I take the pain medication? And she said, whenever you get to your hotel and you get something to eat. And so me and my mom get in the car and shut the door, and I'm like, give me the pain medicine. So I took the pain medicine as soon as I got in the car. I was not about to wait for that stuff to kick in because I was in some pain. I had a really bad headache, and I just wanted to pass out. Well, unfortunately, that did not happen. So after my first breast augmentation, all I remember is getting out of surgery, going home, and going to sleep all night long. After this one, I stayed up for, I'm not even kidding you, 16 hours. So apparently there's some kind of effect that you can have where you get a basic euphoria, or really a lot of energy from the anesthesia. And apparently that happened to me because my mom said I was talking 90 to nothing after the surgery. She didn't say that I was sounding crazy or anything. She just said I sounded like I had a lot of energy. I was not able to go to sleep. I tried. I finally went to sleep at 4 a.m. the day after my surgery. So I had surgery at 7:30 a.m., went in for the surgery, and then that night I stayed up all the way till 4 a.m. So I really did not feel like I got a lot of rest that first few, I stayed in the bed for the most part. I was walk around every couple of hours because they tell you to do that so you don't get a blood clot. So I would walk, in the hotel room. We didn't really go anywhere. I didn't feel like I couldn't go out. I just felt like, I wanted to be resting. But that first 24 hours was the roughest, I'll say. And probably most people would say that as well. The pain wasn't unbearable. I wasn't crying. I thought that was a good measure of if pain is really bad, you'll probably cry, especially as women, because we're just that's just a natural release. So I did not cry, and I was able to just take, I think they gave me 10 pain pills to last for the whole duration of my recovery. So I talked to the doctor about that. That was one of the things that I was not happy with because I felt like they were forcing me to ration pain pills. And I had my literal nipples cut on. So I really did not feel like this was the time to be, kind of rationing pain pills. And when I asked my surgeon about that at the post-op appointment, he was like, well, most people are off the pain pills in 2 or 3 or 4 days. So honestly, I was not super pleased with how their office conducted their business and how they acted, but I think the results made up for how they acted. They were kind of just like you would think a plastic surgery office would be, kind of kind of snooty and kind of like, I don't know, like I just didn't like the vibe there. None of the people who worked there were particularly pleasant, and I was kind of surprised by that because, you know, of course when they're selling it to you on the phone and you're coming in and stuff, they're being really nice to you. But as a patient there, I was not overwhelmed by the patient care. So that was one thing that kind of happened that kind of rubbed me the wrong way. But like, I don't know, like I guess as a business owner, I know how I run my business and how I treat my customers. So I want everyone to feel welcome and feel like, you know, they're safe there. So I didn't necessarily feel that. My surgeon was nice, but he was not really super personable. And that may have something to do with the fact that he's, you know, gone through a lot of schooling and stuff, but I knew that his results were going to be good because I had seen several of his before and after pictures. I had read like testimonials online of people who had worked with him, and I was really happy with that. So I will, you know, message you his name if you want it. It's not the ones that are over the main office. He is actually a surgeon who moved there. But I mean, I'm happy with the results, and that's what I feel matters. But I do wish that, you know, I had gotten a little bit better of care, especially pain management. Because I mean, I don't know what's typical. If you've had this surgery, please feel free to comment what they gave you for pain management, because I felt like 10 pills just forced me to have more pain than what was necessary. They also told me to take ibuprofen and Tylenol on a rotation, so every 3 hours take one or the other. So I've been doing that for the first week, and then I also had muscle relaxers. Now he did prescribe, I think, like 56 muscle relaxers, and he did prescribe nausea medicine. So the muscle relaxers, basically your muscles are really going to be like tightening and moving a lot. So those are supposed to help with that. I think it was methocarbamol was the ones. Not a huge fan of those. They didn't really, I've had them before for my back, and they didn't really seem to do much for me. So that's where I'm at with that. But in terms of the pain was mostly concentrated around my nipple area. The incision that I had was basically an anchor. So it went around and then it went under and up. So it was a lot of cutting. I've got incisions all the way down on both breasts, and then it goes through the middle and then around the nipple. So I've got a lot of incisions right now. So I mean, I felt like the last couple of days I felt okay. I felt mostly just soreness, a little bit of stretching from the new size, but not bad. He told me that since I'd already had 400 cc's, that having an extra 150 was not going to be too bad. So it really didn't feel like I had implants put in. As far as like when you first get implants, if you've had smaller breasts, you feel a lot of like stretching. So that's one thing that I didn't have to deal with, which was kind of nice. Yeah, so the medicine they gave me was hydrocodone 5 milligrams. I had this written down, and that was that on top of the Tylenol, and the ibuprofen is just what they told me to take for pain. I made sure that I kept my hands really clean. I did use gloves when applying any of the medication, and then I also just tried to make sure that I did not touch anything. I didn't want to touch the incisions or touch my chest or anything, and I tried to wash my hands as frequently as possible just to kind of keep it like a sterile environment. You're not allowed to take a shower until 2 days post-op, but as soon as I was at that 2-day mark, I did take a shower. It wasn't as painful as I thought it was going to be. I honestly thought it was going to be awful, because I thought, oh my god, the minute the water hits this, it's going to be terrible. But it actually felt really good, because I had noticed like it had, on the 3rd day, I had started itching like so bad because everything was starting to heal. So I mean, that was a good sign that I was itching, but also I was like, oh my god, like this is driving me crazy. I've taken a shower pretty much every day since day 2, because it just feels good to get that, like, I basically have an itch that has been scratched kind of feeling. So one weird thing after my surgery is I felt like I could smell my implant. Like I felt like I smelled silicone. I don't know what that was. I don't know if that was an internal thing, but for the first 2 days after the surgery, I legit was like, this smells to me, like it's bothering me. So I felt like that was kind of strange, but I mean, it did go away, thank God. I know a lot of people said that they felt the same thing, so I guess that's just a weird side effect of having a foreign body put in your body. So after the surgery, I finally went to sleep at 4 a.m. Well, I had a post-op appointment for 8 a.m. the next day, so I barely got any sleep. I wound up going to my post-op appointment. They looked at the incisions and everything, and basically just told me to kind of keep putting cream on my nipple and to just go home. So that's what I did. I went home, and then on, I think that was on a Saturday, and then on Sunday, I had like a lot of darkening around my nipple area. It was really bruised and I was starting to get worried about it. So I sent pictures to their office and they told me that they wanted me to come in on Monday to have it looked at just to make sure that everything was okay. Everything wound up being okay, but the concern when you have any kind of lift is that the tissue around your nipple could potentially die and you could actually lose your nipple. So I was kind of freaking out for a minute there, but I thought it was just bruising, and it was just bruising. But we did have to drive back to Birmingham on Monday to check out everything and make sure it was okay. So, I mean, to be honest, if you're taking this surgery and you're thinking it's just going to be like a quick thing, plan to have at least 2 weeks off of doing your normal life, because you don't know what kind of complications could arise. I mean, you can probably go back to work after a week if you have like a desk job, but I honestly would not push it, because if you want to get good results, you need to be able to heal in like a calm environment. And so that's been the biggest thing for me, and that's what my boyfriend keeps getting on to me about, is that I have really struggled to be still and to not move. One of my things is like, you're not supposed to pick up more than 10 pounds. Well, all of my dogs weigh more than 10 pounds, so they're not supposed to be getting on me. I just wanted to put up my Christmas decorations, so my mom had to come over and help me put up everything. Thankfully, she put my tree up and helped me so much, so she's really been great. She was my nurse during this whole entire thing, so I'm thankful for that. My mom is actually a registered nurse, so I could not be luckier in terms of having someone to help me with post-op care. She stayed with me and pretty much stayed up the whole time that I was up, so she took really good care of me. So one thing I would really recommend is whatever you want to do before your surgery, make sure you do it. Like if you want to clean your whole house top to bottom, if you want to pick your kids up for the last time, if you want to go for a run, get that all out of your system and make sure that you feel like you did what you could, because you're honestly not going to be able to do much after your surgery. I'm 10 days post-op today, and just doing this hurts. Twisting hurts. I can't really lay on my side. I hate laying on my back to sleep, but that's pretty much the only way I can sleep like comfortably, but also it's not comfortable. So there's no comfortable sleeping position right now, because I have back problems from a car accident, so I have chronic pain. But I will say that the chronic pain kind of prepared me for this pain, because it doesn't really even feel that bad, because I've been in pain for so long. I've been in pain for like 2 years, so more pain just feels like more pain. I don't know how to explain that. If you don't have chronic pain, you'll probably never be able to truly get it, but basically it just feels like, yeah, this is just a regular day, but except for it's a little bit worse than that. I will say, seeing myself cut on so much was kind of horrific. I'm not gonna lie. And I got like a sick satisfaction out of seeing the pictures. I asked my surgeon to see some of like the gory photos, and he showed them to me, and I was like, oh my god, like there was just some part of me that just wanted to see it. So he showed me some of them, and they were gnarly, like absolutely gnarly. I saw like all the fat and the inner tissue of my boobs, and I was just like, good lord. So if you like boobs, never look at what's inside of them, because you might ruin it for yourself. But I mean, overall, I was really impressed that my surgeon was able to take that silicone implant out after it had ruptured. He said that they had to pour in something to get it to like come together, because it's really sticky to get it out. But he showed me a picture of it, and it was basically just like all exploded looking. I'll show you guys a picture, but it also has a picture of some of my skin that he took out. So just, if you don't like gory stuff, don't look at this picture, please. Okay, so you can see it is like, it's gnarly. You can see the implant that is intact, and then the implant that it had ruptured. So very thankful that I was able to get that out. And I mean, for I think $7,700, I feel like I paid on the mid to lower end of what this surgery would typically cost. Because if you're just getting implants, it's one price, but if you're getting a lift as well, the price of the surgery goes up quite a bit, because a lift is a lot more technical. It has a lot more to do with removing skin, removing tissue, and I think, you know, most women, as they have children or they get older, they're probably going to be candidates for a lift as well. I'm getting hot from all the talking. One thing I'll say is that whenever I was trying to choose the size that I wanted to be, everyone that I was looking at was skinny, and so it was really hard for me to determine the size, because like a lot of the pictures that these offices use are on really small women, and I am not small. Like I'm 170 pounds right now, so I really did not know, like whenever you see a skinny woman and you see she got you know, 400 or 500 cc's, they would look huge on her. But for me, it kind of was proportionate to my body to get that size. So it was really difficult to find like an actual photo to show my surgeon to begin with. So I do wish they would show more diversity in the people that they work with. It seemed like most of the pictures were skinny people, which I don't know, like I feel like my waist looks smaller just from having the larger breasts, but it's definitely motivated me to take my diet and stuff more serious and to start being even more active. I'm really active in my normal life, but like this kind of made me want to go back to being like a gym girly, just to kind of have that final look that I want to have, the final aesthetic, I guess, because right now I feel like, you know, my arms need toning. I've lost weight, but like now I've got like this skin kind of thing going on, and you know, my stomach's still got the fat. I'm not skinny by any means, but like I do feel really confident and I feel good about the decision to have surgery. I don't feel any shame or stigma. It's literally just like, I don't know, like we're on a floating rock. So if you want to change your body, change your body. Like it doesn't really matter. I don't care whose opinion, you know, the only person whose opinion mattered with this was my opinion. And then of course I have a supportive partner, so he really did not care. Like he just said, like, do what makes you happy. And that's honestly what I did. So I'm really happy with the results. And so being on day 10 of post-op, I can kind of see a light at the end of the tunnel. I'm going to say the first 4 days, lots of pain, but not something that was unbearable. I literally went like shopping on like the 3rd day post-op. So, I mean, as long as I make sure I don't pick up anything heavy, I think I'm going to be okay. I'm definitely not the type of person who could sit in the house. I do not sit in the house. That is just not me. I'm usually going at least somewhere once a day, like run an errand or come up with something to do. So, you know, my doctor told me I can walk. He said you can walk 3 to 4 miles a day if that's what you want to do. So I'm just going to continue to walk and continue like not to push it. I'll probably do an update either 6 weeks or 6 months post-op to kind of show, because one thing that happens when you have breast implants is that when you first get them, they're actually really higher than what they're going to be. They will drop a little bit. So they call it like drop and fluff. And so that will happen hopefully in the next couple of months. But right now they're really not like stupid high, I don't think. They just kind of look, for the first time in my life, I feel like I can buy a V-neck. Like I looked at my closet a minute ago because I was like, well, let me find something to wear in this video that like isn't crazy, but also you can actually see what I'm talking about. And I had ordered this top from Amazon. It's like a little crop top. I ordered a size XXL because I thought my boobs were not going to fit in an extra large, but it actually fits. It's a little bit loose, so probably gonna have to get an extra large. But basically my whole life I've never had like any cleavage or any V because all of my breast tissue was like lower. So basically I would fill up the bottom of the bra, but I wouldn't fill up the top of the bra. So now I feel like it's more proportionate to what I actually wanted. It's definitely something that's going to take some getting used to. I had a lot of big feelings about it, but you know, I was also kind of like, you know what, you've just had surgery. It doesn't look like what it's going to look like, you know, long term. You really have to let things heal to see how they're finally going to look. So after my surgery, I had a lot of swelling, obviously, a lot of swelling. I was bloated. I did not look great. And so, you know, just don't take those first couple of days. Don't look in the mirror. Don't worry about it. Just take care of yourself. Make sure that you're eating. Make sure that you walk around so you don't get any blood clots. But I would say like that first week, just take it easy and don't worry too much about the results, because the results are going to come in time. Just make sure that you're staying on top of your health and everything will work out. So in terms of my bra size, I do not know exactly what I'm going to be. I tried on some of my bras. Some of them still fit, some of them really don't. Most of my bras are sports bras or like bralette bras anyway, so I'm not sure exactly what size I ever was. I think I was around a 38D. And now I'm probably definitely like a double D. But I would say right now a lot of the bras that I have are like XXL bralettes, and they fit me pretty good, like this one. So yeah, only time will tell. I'm just gonna keep working on everything, keep working on my health, trying to take everything one day at a time. I am trying to do high protein because a high protein diet is a good way to heal after the surgery. So I'm going to continue with my high protein and continue being active. And yeah, I guess this is maybe something that not everyone would talk about or even admit to having done, but I just wanted to be open and honest with you guys and say that like, if this is something that you're considering, I would definitely like go the step forward to have the consultation, because it really has helped me improve my confidence in life. Ever since I got it done when I was 18, I was happy with the results. I've always felt like that was a good asset that I had. I always felt happy and, you know, confident in terms of how my boobs looked. So yeah, I mean, whatever. I guess if it's something you really want to do, I think it could be good. I think, you know, anytime we do something that like affects our confidence, you can definitely feel yourself shift. I've almost felt like more me, if that makes any sense. Like, this is the person that I want to be. This is like the body that I want to have. And it's also motivated me to continue doing like self-care, continuing doing self-work, and just improve overall as a person. And I know that like aesthetics are not the most important thing in the world, but you know, as we age and as women age especially, there's a lot of pressure for us to look a certain way. So I mean, I certainly didn't do this because of any exterior forces. This was definitely a decision that I made for me, but it does affect how my everyday life goes. So I'm definitely happy with the decision. Thank you guys so much for watching. I will update you guys in a couple of weeks. Thanks.